it's really difficult for patients to stay adherent on medications if they don't understand the nature of their illness and why their illness needs medications. If they have cognitive deficits or negative symptoms that their medications aren't targeting, they may perceive that the medications aren't really that beneficial to them. And of course, if they have refractory positive symptoms, despite being compliant on their medication, then they may eventually perceive that that medication is not beneficial for them either. So all of these things can really impact whether or not patients have gaps in therapy and whether or not they're going to continue to be stable. So now, this is what physicians think. And I think one interesting thing to look at is, what do patients think, right? Where do they perceive the gaps in treatment being? And so this is an online survey of about 200 patients with schizophrenia who'd taken an antipsychotic in the last year. And one of the results of this really caught my eye, and I think it's so important to stress. Sometimes we get really negative about the perceived efficacy of our treatments. In this survey, most patients reported that the antipsychotics actually did improve their schizophrenia symptoms and that they felt that they needed to be on an antipsychotic medication. It was a clear majority of patients that reported that. And they also reported that they felt that these medications did more harm than good. And so overall, this is a group of patients that actually was in favor of taking antipsychotics and recognized the need to take antipsychotics. And I frame it that way because I think on the flip side, this same group of patients that really felt that they needed to take antipsychotics, that the antipsychotics were beneficial for them and caused more harm than good, 98% of them also reported some kind of side effect. And so they would report things like anxiety or feeling drowsy or tired or trouble concentrating. And these are patients who feel like the medications are beneficial for them. And so you can just imagine what this looks like if a patient doesn't feel like the medication is that beneficial for their symptoms or isn't controlling their symptoms that much. Even in this group where they like the medication, they're still going to experience some side effects. And side effects can, of course, lead to discontinuation. And so here are some of the most common reasons that patients discontinue their medication. Because in this same survey, the one where patients said, I need to take meds and the meds are beneficial and they do more harm than good, about half of them had stopped taking their antipsychotic at some point. And 2/3 of the people that stopped because they had some kind of a side effect. And when they were asked which side effects led them to stop, these are the ones they came up with as being the most common. Not the only ones, but the ones that came up the most. Weight gain, feeling drowsy or tired, and feeling quote unquote like a zombie. This was why they stopped their meds.